Hello and welcome to Dr. Z Educational Video. If you are watching this video, either you are one of my patients and during the consultation I've given you a QR code or a barcode, or you are a friend of my patient who has passed that code to you. In any case, welcome. And today we are going to talk about acne. Acne is extremely common illness, unfortunately, happens usually in between ages of 14 to 35 years of age. And when we are using the word acne in this particular video, we are talking about common acne, which we can see on the face, on the neck, on the chest, and the back of the patient. We are going to talk about what acne is and how it develops. Treatment will not be the part of this particular video. So in this slide, you can see a cut section of the skin, which is showing multiple layers, but mainly dermis and epidermis. Dermis is the area where the proper skin is, with epidermis is on top of the dermis, which is made up of number of layers, and that has multiple functions. One of that is to have a protection. If you can see, the hair follicle actually develops in the dermis, and then it basically keeps on going through the dermis and through the epidermis and in the outside wall. But where you can see that the hair is coming out from the top layer of the epidermis, there's a tiny bit of a dent, and through that dent, sometimes the dead tissue of the skin, which are in the surrounding area, they can actually go inside and they can keep on going. And then in certain individuals, that can be one of the cause of the acne as well. But if you see closely, the hair itself is actually part of the epidermis or the top layer of the skin, but it is the hair follicle is residing in the dermis. Next slide is about the layers of the epidermis. It's not very important for this particular video, but the main purpose of that is to show to how many layers are there in the epidermis. Next slide, you can see a little bit of a close-up of the hair follicle and the hair itself. And in that, if you can see that there is a small gland in the middle part, somewhere in the middle of the hair, which is called sebaceous gland. This gland produces a material called sebum, which is an oily material or oily liquid. And that liquid is responsible to clean those dead tissues which are coming inside from that area from the hair, which was coming out of the epidermis, and has other functions, including moisturizing of the skin around the hair cells. So you can think of it that we have a natural moisturizer inside our skin with almost each hair cell, which is there. Now, in the next slide, you can see that gap, which is basically there and where the skin cells go inside, and how the sebum can actually clean it up. And in next slide, if you can see that that's the same phenomenon shown along with other things there. Now, what is happening when we are in the teenage years or whenever there is under the influence of hormones, we are producing too much sebum or we are producing too much oil. When we are at teenage ages, usually the hormones are released quite high in quantity, and that affects that gland, and that gland will start producing too much oil. Now, that oil will keep on cleaning the area, but at the same time, the area where it is getting produced can be that it is not enough for the amount of oil getting produced. By virtue of that, we will basically see a little bit of a bump, a pressure from the back, which will feed on the skin. And it doesn't happen to every individual, but those individuals who are genetically predisposed to have that, they will have that bump. And that bump is what we call whitehead. That's usually the first stage of the acne development. If that bump stays there and the oil, which is in that area, starts oxidizing with the oxygen in the environment, and there is a pigment called melanin in the skin, in the epidermis. And those two things combined together makes the area look black, and that becomes a blackhead. So whitehead usually follows with a blackhead, but some people will not notice whitehead and they will directly get the blackhead. If the blackhead doesn't get treated, then the bacteria on top of our skin, which is in that surrounding area, will start getting inside this plug and then start multiplying. When the bacteria starts to multiply and grows more in number than they usually supposed to be there, then the body gets the message and our immune system goes and start attacking that area. by virtue of that, it creates the redness and the swelling in that area, which causes the inflammation. And that is when the pain and the bumps are coming more redder, and a little bit of puffy discharge might be coming. So this is we call cyst. And if the cysts do not get treated at the right time, quite often they will turn into a scar. But once the scar has made, then although it is possible to get it treated, but it is not very easy. So ideally, if somebody is suffering with acne, it is a good idea to get it treated before the scarring happens, so that the treatment can be done. Hopefully, I'll see you shortly, and we can discuss about the treatment later. Thank you.